Welcome, and thank you for joining us for this recorded webinar for the Introduction to the Homeless Emergency and Active Readiness Toolkit, or HART. This webinar is brought to you by Step Up. This is the first of a 4-part webinar series on the toolkit. Stay tuned till the end of the video to learn more about the upcoming videos in the series. During this webinar, you will be hearing from Gabrielle Watson with the California Interagency Council on Homelessness, Caressa Smith with the Cal-ICH Lived Experience Advisory Board, and Monisha Avery with the California Governor's Office of Emergency Services. In this webinar, we will discuss introducing the Homeless Emergency and Active Readiness Toolkit, the goals of HART, how HART can help, the audience of the toolkit, creating the toolkit, how to use HART, and what's ahead in the webinar series.
Hello, I'm Gabrielle Watson, and I'm a specialist on the local initiatives team with Cal-ICH. A tremendous amount of work went into the creation of the Homeless Emergency and Active Readiness Toolkit, or HART for short. And we hope that this will be a valuable resource for local jurisdictions in preparing and planning for future disasters and emergencies affecting people experiencing homelessness. While this resource aims to ensure the well-being of people experiencing homelessness during declared emergencies specifically, it is important to underscore that hundreds of thousands of Californians are experiencing the urgent crisis of homelessness every single day. This is exacerbated by the increasing frequency of natural disasters in our state. HART is a resource that was developed in collaboration with the Strategies, Tools, and Emergency Preparedness for Unsheltered Populations, or STEP UP, State Interdepartmental Group. This group was formed in response to the winter storms of January 2023 to support local communities in preparing and planning for future disasters and emergencies affecting people experiencing homelessness. Step Up aims to underscore the critical role of an organized, collaborative, and effective local disaster response to ensure the safety and stability of people living without shelter throughout California. Step Up is led by Cal-ICH and includes representation from 6 state departments: the California Governor's Office of Emergency Services, Department of Public Health, Department of Social Services, Department of Transportation, Department of Education, Department of Aging, and going forward, Step Up will be expanding to include Department of Housing and Community Development. The goals of Step Up include creating, streamlining, and disseminating information, guidance, and resources to support system leaders in advance of a disaster or emergency, developing and disseminating resources that assist local jurisdictions in preparing for and responding to disasters and emergencies impacting people experiencing homelessness, enhancing collaboration and coordination among stakeholders, and supporting the inclusion of people experiencing homelessness in emergency planning and response efforts. Next, we will talk about the toolkit goals. To support the goals of this group, Step Up developed a toolkit aimed at assisting local emergency managers and city and county homelessness and housing department leadership and continuums of care by creating a shared understanding of the needs of people experiencing homelessness during a disaster or emergency, and identifying opportunities for coordination across different entities and services. Informing local partners of respective roles and capacities, and supporting local interagency collaboration to create structures and resources for integrating people experiencing homelessness into disaster planning and response efforts, and providing strategies for supporting people experiencing homelessness during disasters or emergencies, particularly people experiencing unsheltered homelessness. Before we move on to discussing how the toolkit was created, we'll hear from a few partners about how the toolkit can help. First, we'll hear from Caressa Smith, a member of the Cal ICH Lived Experience Advisory Board. She will be discussing how disasters and emergencies impact people experiencing homelessness in her community and how the toolkit can provide support when communities are planning ahead for a disaster or emergency.
Hi, my name is Caressa Smith, and I'm a Cal ICH Lived Experience Advisory Board member. I represent a rural community, which is Clear Lake in Lake County, California. I'm able to contribute to the Lived Experience Advisory Board by contributing input and perspective on rural community needs. Rural homelessness looks a lot different than urban homelessness in the sense that you can't see it. And a lot of places where people are at, they're hiking, there's dirt roads. There's not the transportation system that you would see in urban areas. So relationship building and preparing beforehand is critical in disaster planning because you have to have relationships, you have to know the land, and you have to know where to find people because a lot of the places aren't drive-in. You really have to hike in, and a vehicle will get stuck if you attempted to drive. So it looks a lot different, and just having those relationships and connecting with people experiencing homelessness before disaster is really critical because you won't be able to do things day of or easily be able to find people. In my community, Lake County, we've been devastated by wildfires. HART emphasizes the importance of preparing in advance by considering harm reduction and substance use for people experiencing homelessness, accessing emergency shelters. As the toolkit states, many people experiencing homelessness are at an elevated risk of medical complications, withdrawal symptoms, overdoses, and disasters and emergencies. Local health jurisdictions can provide guidance and support in the preparation of emergency shelters. I serve as a community health coordinator for Adventist Health, and we have a team of community health workers that bring the shower trailer project to emergency shelter evacuation sites. Our team is trained in harm reduction and is able to provide trauma-informed care to people that may be experiencing withdrawal or need harm reduction support. During our latest fire, which was the Boyles Fire that happened in September of 2024, there was a woman experiencing homelessness that was evacuated with her dog from her encampment. She was experiencing alcohol withdrawal and was not permitted to go inside the emergency shelter and to get out of the extreme heat with her dog. Our team was able to assist by providing trauma-informed care to this woman and her dog. We were able to get her medical attention for alcohol withdrawal, as well as partner with her to get her and her dog to a shelter where they could go inside out of the heat. She received wraparound care and is now enrolled in Cal AIM Housing Navigation Services and is actively working with the community health worker case manager on a care plan addressing her barriers to housing. She was experiencing complex trauma and stress during this disaster. Our community health workers recognized that and were able to partner with her on a plan that was her choice and that worked for her. As stated in the toolkit, people experiencing homelessness are already facing high stress situations that can affect their safety and well-being every day. Emergencies and disasters can trigger and re-traumatize people experiencing homelessness. Our team, comprised of community health workers with lived experience of homelessness, assist our community's emergency shelter by integrating trauma-informed care into emergency services. We are all extensively trained in SAMHSA's 6 guiding principles of a trauma-informed approach this toolkit emphasizes, which are safety, choice, collaboration, trustworthiness, empowerment, and cultural, historical, and gender issues. This toolkit is necessary because California will continue to experience more and more frequent disasters due to climate change. These disasters will continue to have a significant and long-lasting impact on the estimated 181,000 people experiencing homelessness on any given night in California, 70% of whom are unsheltered, and that is from the HUD Exchange 2024. By utilizing this toolkit and planning in advance, communities can help move the dial and improve disheartening statistics for our neighbors experiencing homelessness. For example, the life expectancy rate for people experiencing homelessness is 17.5 years shorter than the average population, and the death rate due to hypothermia, freezing, is 13 times more higher among people living without shelter. As a community health worker, I've been deeply impacted and devastated by people I work with experiencing homelessness, losing their lives by freezing to death. By including people experiencing homelessness in emergency planning before disaster strikes, we have a better opportunity to reduce these numbers and prevent these preventable deaths. HART emphasizes how important it is to include people experiencing homelessness in emergency planning by planning with people and not for people. This toolkit also provides a framework to evaluate community emergency response plans by giving communities an opportunity to build and expand on what is going well. For example, in my community, emphasizing the importance of community health workers with lived experience of homelessness is something that is positive and vital during emergencies. This toolkit also provides a framework to evaluate areas of improvement and any gaps in planning. HART will have a significant impact on my community because it provides 8 strategies for inclusive planning that will give us an opportunity to collaborate and strengthen relationships which are life-saving in disasters. For example, HART presents a collaborative opportunity for communities to establish an official access and functional needs AFN advisory committee. By establishing an AFN, we will be able to strengthen our emergency response plans by identifying the needs of people with access or functional needs before, during, and after disasters by partnering with people experiencing homelessness. And this toolkit also provides language and strategies to improve emergency response efforts that will be life-saving when utilized.
Thank you, Caressa, for sharing. We will now discuss the audience for the toolkit. The toolkit is aimed at supporting local emergency managers and city and county homelessness and housing department leadership and continuums of care. We will then discuss the homelessness response system, including its role and how the toolkit can support its work. We will first hear from Monisha Avery. Monisha is a member of Step Up and the Chief Equity Officer with Cal OES. She will discuss the role of emergency managers and specifically how this toolkit can support them.
Hello. My name is Monisha Avery, and I serve as the Chief Equity Officer at Cal OES. There's one thing I've learned over the past few years about emergency management. It's that effective disaster response depends on planning and preparedness. This is especially important for reaching our most marginalized communities, including those who are unhoused. I've been asked to share how the Homeless and Active Readiness Toolkit can help emergency managers ensure that individuals experiencing homelessness are not left behind during disasters. As we've seen in recent years, California continues to face an increasing number of disasters, including the recent devastation of the Palisades and Eaton fires in Southern California. These events disproportionately impact people experiencing homelessness, who often lack access to timely information, safe shelter, and transportation during emergencies. The HART toolkit was designed to elevate awareness and help bridge this gap by integrating homelessness response systems into emergency planning. For emergency managers, the HART toolkit includes several sections that cover what to do before, during, and after a major disaster. Before a disaster happens, the Emergency Services and Homelessness Response section of the toolkit is a great primer on the different government agencies' roles and responsibilities, and it provides strategies for inclusive planning, including people experiencing homelessness or those organizations serving these communities in disaster planning is essential to both understanding and educating our community. During a disaster, the effective communication section ensures that critical information reaches the unhoused population. The evacuation and transportation section ensures that the proper resources are available to get these community members out of the impacted areas. And in the emergency shelter section ensures that shelters are set up to properly account for and support the unhoused population. And after a disaster, the transition to recovery section provides emergency managers with many practical ideas and suggestions to better address the challenges people experiencing homelessness typically face and have been made more severe due to a disaster. Emergency managers take hundreds of hours in training to learn and stay up to date on emergency management. In my experience, and in conversations with some colleagues at Cal OES, more information and training are needed regarding the unhoused population. The HART Toolkit is a great resource to those new to emergency management, as well as the more seasoned manager, by providing a wealth of information in an organized and digestible manner. Some key takeaways from the toolkit are that it introduces many of the government and non-government agencies involved in supporting the unhoused population. It can help prompt emergency managers to engage with these organizations, to build relationships, and to actively participate in disaster planning and recovery work groups and training. And lastly, emergency managers can use the toolkit to update their emergency plans to ensure the inclusion of the unhoused population. Thank you for letting me share this time with you, and I'll pass it back to Gabby.
Thank you, Monisha, for sharing. Now that we better understand the role of emergency managers and how this toolkit can help them, we also want to share a bit about the homelessness response system and how this resource can help city and county homelessness and housing leadership and continuums of care, as well as other partners. The Homelessness Response System is a collaborative network of various organizations and agencies committed to assisting people experiencing homelessness. The overarching goal of the Homelessness Response System is to facilitate a swift transition from homelessness to stable, permanent housing, ensuring that individuals receive the support they need to exit homelessness and maintain their housing. Continuums of care serve as the central organization within the homelessness response system in each community. COCs are responsible for coordinating housing and supportive services and are also responsible for data collection. HART provides a wealth of information on how COCs and homelessness response leadership can participate in county emergency and disaster planning to ensure people experiencing homelessness are included in disaster planning and response. This is detailed throughout Section 1 of the toolkit, Be Informed, and scattered throughout the toolkit in collaborative opportunities call-out boxes. Additionally, more information on how the homelessness response system can support can be found in the Emergency Services and Supports Roadmap within the appendices at the very end of the toolkit. The toolkit also provides helpful information about how other community partners may be valuable collaborators in the planning process when preparing for and responding to disasters affecting people experiencing homelessness. We want to explain how the toolkit was created. To create the toolkit, Step Up completed several information gathering activities. The group conducted a review of information from a variety of resources, including HUD's Disaster Toolkit, resources from FEMA, Cal OES, SAMHSA, the National Alliance to End Homelessness, and many more to create the content for this toolkit. The team also integrated State Department information, such as the department's role during disasters and emergencies, resources and guidance they have created, as well as their contact information. The team also reviewed 58 county emergency operations plans and annexes to better understand the inclusion of people experiencing homelessness currently in local plans. Upon review of the 58 county emergency operations plans in California, it was found that 28 of the plans did not refer to people experiencing homelessness at all. 30 emergency operations plans mentioned people experiencing homelessness, but this was often a mention of the inclusion of this population, but did not include further information about how people experiencing homelessness would be supported during a disaster or emergency. There were a few plans that did provide exception to this, going into specific detail to support this population, and those are some of the communities that have been highlighted throughout the toolkit. A survey was also distributed to California's continuums of care, counties, and large cities to better understand current emergency planning practices. Also to identify gaps in response efforts and to collect any recommendations for supporting people experiencing homelessness in disaster and emergency planning and response efforts. Of the 29 completed surveys that we received, survey respondents identified 3 specific actions that could be taken to improve coordination, including increasing collaboration, conducting joint training and exercises, and communicating clear roles and responsibilities. Survey respondents emphasized strengthening relationships across systems to address the needs of people experiencing homelessness during disasters and emergencies, including engaging people experiencing homelessness in planning and response efforts. Respondents also recommended that staff across the 2 systems, the emergency response and homelessness response, participate in joint trainings and exercises to build trust, improve coordination, and prepare for future disasters and emergencies. Lastly, respondents recommended communicating clear roles and responsibilities to ensure everyone understands their role and to provide cohesion during emergencies. Additionally, the group sought input and expertise from the Cal ICH Lived Experience Advisory Board, or LEAB, in the formation of this resource. LEAB members identified specific concerns and actions for reflection and inclusion in the toolkit, and they are the impacts of criminalization, building trust and rapport, partnerships and collaboration, access to information and training, communication, evacuation, and transportation, and shelter solutions. The discussion with LEAB members concentrated on strategies for engagement, accessibility, essential services, and transition to recovery. The group pointed out challenges such as communication issues in areas with limited Wi-Fi, the need for permanent housing solutions, and the unique challenges faced by people experiencing homelessness. LEAB members discussed ways to improve emergency preparedness and response for individuals experiencing homelessness. They emphasized the importance of cultural sensitivity, coordinating efforts among agencies, and access to basic facilities such as showers and laundry services. The importance of providing pre-emergency preparation for people living unsheltered, expanding community health worker programs, and training for outreach workers was also stressed. All of this feedback received through these engagements was then integrated into the design and content of the toolkit. The team also conducted interviews with 6 local jurisdictions to learn more about effective local practices to support people experiencing homelessness during disaster or emergency. And these are highlighted as exemplary practices throughout the toolkit and are intended to provide resources and tools that can be replicated. The exemplary practices highlighted within the toolkit include Alameda County, who actively engages with people experiencing homelessness to shape their disaster response strategies and includes those with lived experience to support before, during, and after disaster and emergency. Butte County, who revolutionized service delivery by streamlining access to services by implementing the use of the COC service card. Individuals scan the card when they access services from participating service providers. An open homeless management information system allows approved providers to view information from clients who have consented to share their data across providers and services. Riverside County, whose use of pop-up emergency shelters during Hurricane Hilary offers other communities an example of the effectiveness of a collaborative, well-planned approach to disaster response for people experiencing homelessness. The County of Santa Barbara, whose extreme weather protocol is a successful approach to protecting people experiencing homelessness during extreme weather events. The protocol emphasizes clear communication, logistical preparedness, data tracking, and leveraging existing resources. The Sutter-Yuba Homeless Consortium, who has strengthened collaboration through the development of the Access and Functional Needs Committee, focusing on emergency and disaster events affecting people experiencing homelessness. And finally, Tulare County, who follows the constellation model, a network of interconnected groups and individuals working together to integrate the needs of people experiencing homelessness into emergency preparedness and response activities. This coalition tackles the challenge of filling gaps in support services by fostering information sharing and resource allocation. More information on the local exemplary practices can be found within the toolkit. Now we want to discuss how to best use the toolkit and where to find the information you might need. The toolkit presents a three-part approach to addressing the needs of people experiencing unsheltered homelessness during disaster and emergency, which is divided into 3 sections: be informed, get connected, and take action. Section 1, be informed, emphasizes the importance of understanding the unique needs of people experiencing unsheltered homelessness, understanding the emergency response system and the homelessness response system, and encourages readers to learn about their county's local emergency plan. This section aims to support understanding across these 2 very different systems, the emergency management system and the homelessness response system. This section aims to bridge the gaps so these systems can better work together. In this section, you will find details about continuums of care, coordinated entry, and HMIS, the Homelessness Management Information System. You will learn about the emergency management structure and about emergency operations centers, as well as emergency operations plans. Section 2, get connected. This section stresses the need for collaborative partnerships and the inclusion of people experiencing homelessness in emergency planning processes. It promotes a whole community approach that brings together all relevant partners to meet the needs of people experiencing unsheltered homelessness during disaster. In this section, you will find 8 strategies for inclusive planning, and you will learn more about access and functional needs committees. Additionally, you will learn about the roles and responsibilities of emergency services and homelessness response providers, and the opportunities to bring in community partners to better support people experiencing homelessness together. Section 3, take action. This section advocates for a proactive and comprehensive approach to address the specific needs of people experiencing homelessness during disasters and emergencies, focusing on communication, transportation, shelter, essential services, safety, equity, trauma-informed approaches, and transition to recovery. For example, in the toolkit, one of the topics covered is communication. The toolkit offers considerations for content and messaging, such as creating clear and concise language and using culturally appropriate messaging. Additionally, within communications, accessibility and reach is discussed. This includes considerations for thinking beyond TV or radio as a way to get information out to people experiencing homelessness during disaster or emergency, and encourages utilizing multiple and diverse communication platforms, as well as utilizing existing connections and knowledge of people experiencing homelessness. Each section of the toolkit includes a key takeaway segment, highlighting the major themes within that section. Each section also includes a tools and templates segment that provides various resources related to that section. One example of this can be found in the Emergency Management in California chapter of the toolkit. In this collaborative opportunities box, it says, to fully integrate access and functional needs considerations into local emergency operations plans, emergency managers can work with the COC to develop comprehensive emergency operations plans inclusive of the needs of people experiencing homelessness, and ensure that access and functional needs related considerations for people experiencing homelessness are fully integrated into the planning process. There are also exemplary practice call-out boxes providing local community examples of the concepts discussed throughout the toolkit. The exemplary practices come from the communities that were mentioned earlier, and they are denoted by a blue box within the toolkit sections. Lastly, there are several appendices included in the toolkit that provide additional information and materials to further enhance understanding and implementation of the concepts and strategies discussed. This includes checklists, contact lists, a roadmap of emergency services and supports, and other helpful information. And finally, let's discuss what is coming up next. This webinar is the first in a series of 4. Webinar 2 will be focusing on the first section of the toolkit, Be Informed. Webinar 3 will be focused on the second section of the toolkit, Get Connected. And webinar 4 will highlight the third section of the toolkit, Take Action. During each of these webinars, we will dive into that particular toolkit section and we'll highlight exemplary practices that align with that portion of the toolkit. We will offer time to hear from each of the 6 communities throughout the webinar series in the hopes that other communities may find inspiration and creative ideas on how to support people experiencing homelessness in their own communities in preparation for disaster or emergency. Additionally, we'll be releasing case studies of each of the exemplary practice communities alongside future webinars in this series.
Thank you for joining us for this introductory webinar for HART. The recorded webinars are available on our website at bcsh.ca.gov/CalicH/HART. If you have any questions about the toolkit, please email us at calich@bcsh.ca.gov. If you like this video, please like and subscribe. You can also follow us on social media here. Thank you.